Ivy.
Ezekiel, you done married me again?
Ivy.
Ezekiel, the lamp turn over.
Ivy.
Ezekiel, the house abandoned.
Ivy.
Papa Jesus, who turn off your radio?
Ira FM wishes to advise that the views expressed on Sex-Wise are not necessarily those of the company.
Initializing sex machine.
Ooh, I'm
Muchness.
Sex-Wise. Get ready for a bumpy ride. Wearing protection. Sex-Wise.
Drive me round the corner. Figure show me no iguana.
I'm not going down there.
Allow me, make me grow.
Sex-Wise. You're turning me on.
I don't think I'm in the mood.
It's time to whip out a 12-inch.
Ooh.
Record.
Oh.
Well, you know it ain't the size of it. No, it's the size.
You are now entering a world from which you will never return.
This might be a little uncomfortable.
Sex-Wise.
Good night to all you listeners in Jamaica and around the world. You're listening to IRFM, and of course, this is your late night show. It's called Sex-Wise. I'm your host, Dr. Alverson Bailey, sitting in with you tonight at my favorite post. It's Tuesday, June 24, 2014. It has been a really balmy day, not as hot as it has been for the past 3 days. I had a very pleasant trip from Falmouth to Honduras this evening, and I hope that tonight is for you a good night, and it has found you in a state of good health. And despite all the excitement of the World Cup, you have taken time out to spend the next 2 hours with me, exploring matters of the heart. You know, Sex-Wise, we talk about people, we talk about relationships, and of course, we talk about sex. Last week, Sunday, June 15, was Father's Day. Sex-Wise has been dedicating all its programs this month to celebrate fathers. And we, of course, wish a belated happy Father's Day to all the fathers in Jamaica and, of course, around the world. We know you have been good providers. We know you have been good protectors and, of course, nurturers and role models for your children. And despite all the bashing that you get as fathers, we want to encourage you to continue to play the role that you ought to play and to live up to our expectation. I just want to pause to recognize some fathers who are very close to me. I just want to pause to recognize my uncle, Henry Green from Kingston. I know you're listening. Welcome to Sex-Wise. Of course, I must recognize my boss, Professor Wilson Davison, Professor Earl Morrison, my good friend, Dr. the Honorable John Hall, Dr. Henry Lowe, a good father, Harold Daly, Dr. Winston Delahaye, my good friend in Runaway Bay, Keith Rowe. I know you're listening. I want to wish you a good night and hope you had a good Father's Day. I also want to pause to recognize another very good father, a friend of mine, the man in charge of Burlington Medical Center, Donovan Johnson. Donovan is a dedicated IRFM listeners. Good night to you, Donovan, and I hope you had a good Father's Day. I want to also recognize Juna McIntosh, my lab technician, and a special recognition must be given to Mr. Hussey, my PD, Lady Audrey Hussey's husband, and he's just joined us on IRFM. Thanks for choosing IRFM tonight, Father Hussey, and I'm sure you're going to enjoy the show. Also want to pause to recognize my good friend from the PCA, Dennis Mirage. He keeps complaining That'll keep him up every Tuesday night as he listens to IRFM. Thanks for choosing IRFM, Dennis. And of course, you're in for a good show tonight. I want to remind you that my book, Sexplanation, produced by Pelican Publishers, is available at all your favorite bookstores, such as Sangster's Bookstore, Bookophilia, Kingston Bookshop, and of course S&M Romance in Ocherias. So of course, I want you to get a copy of my book, Sexplanation, and enjoy. You can contact me at alvab@cwjamaica.com or call me at 377-0122 to give me some feedback about the book. Tonight, folks, we have an exciting show lineup for you. The theme of tonight's show really is addressing men's sexual issues. And we're going to be looking at what we can do to preserve and promote the health of our fathers and ensure that they continue to live up to our expectations. Around 9:30, we'll be joined by Dr. Keith Berderman, who is a consultant urologist who hails out of Montego Bay. And Keith will be co-hosting with me tonight as we try and discuss a whole raft of issues relevant to men and their particular problems. Around 10 o'clock or thereabouts, we'll open the lines and you can join us in the discussion. Of course, you are listening to IRFM, and this is your late night show. It's called Sexwise, and you're broadcasting from the friendly and beautiful seaside resort of Ocherias. So 107.1, 107.3, 107.5, 107.7, and 107.9 on your FM band. I'm your host, Dr. Al Bailey. Tonight, folks, we're going to be looking at male sexual issues. We have an interesting show lineup for you. We intend to look at three primary issues. We're going to be trying to address the 10 leading causes of death in Jamaican men. We're going to look at some other major issues. Then we're going to look at some risk factors or lifestyle factors that could predispose to poor health in our men. And then we'll spend some time looking at some risk management, what we can do and must do to preserve and promote the health of our males. So you just keep a dial locked to IRFM, and we have a nice show lineup for you. I want to remind you, listeners, about some facts which I think many of you are either unaware of or perhaps have a passing information about. If I was to ask you, what are the 10 leading causes of death among males 5 years and older in Jamaica? I suspect strongly that many of you would not know. And if you were to look at the demographic statistics published by the Statistical Institute of Jamaica in 2012, the findings are particularly interesting. So let me tell you, the 10 leading causes of death of Jamaican men are external causes. That's interesting. And I think Jamaica is one of the few countries in the world where external causes takes pride of place as a leading cause of death of men. Now, what are external causes? There are accidents, assault, suicide, falls, drowning, burns, and poisoning. We are not taking good care of our men. We are losing them through causes that are eminently preventable, like accidents, especially at the workplace, falls, assault, which has to do with gunshot wounds and stab wounds and other nefarious type of insults that your men has to sustain. Poisoning, of course, is eminently preventable. No reason why we should lose our men from poisoning. The second commonest cause of death of Jamaican men, interestingly, is a stroke. Cerebrovascular disease, i.e. diseases of the blood vessels of the brain, is the second commonest cause of death of Jamaican men. The third cause of death is diabetes mellitus, or sugar. Now, I want you to listen carefully, listeners, because I want all the men to literally sit on the edge of the seat and the women to gather around, because you need to know that the fourth leading cause of death of Jamaican men is cancer of the prostate. We take pride of place in that we have one of the highest prevalence rate of cancer of the prostate in the world. And this is and should be a wake-up call to all our men that in fact prostate cancer is the fourth commonest cause of death of Jamaican men. And when one look at the latest statistics, it indicates that prostate cancer is roughly about 65.5 per 100,000 Jamaican men. Very sobering. The fifth leading cause of death is ischemic heart disease, which basically means impaired circulation to the heart or heart attack. The sixth cause of death is hypertension of the heart. The seventh is cancer of the larynx, which is the voice box, cancer of the trachea, the windpipe, cancer of the bronchus, which is the tube that takes air to the lungs, and cancer of the lungs. The eighth cause of death is chronic lower respiratory disease, which is infection of the lower part of the lung, primarily the area that is responsible for exchange of air, called the alveoli. And now, ladies and gentlemen, the ninth leading cause of death is human immunodeficiency virus, so HIV disease. The 10th leading cause of death in our Jamaican men is heart disease. Now, the interesting factor that we want you to understand as far as these causes of death are concerned is that they are almost all preventable. Strokes, diabetes, cancer of the prostate, heart disease, hypertension, cancer of the lungs and larynx, HIV, all preventable. Interestingly, when one looks at cancers among Jamaican men, prostate cancer takes pride of place, followed by lung cancer, then stomach cancer, then colon cancer, followed by liver cancer, followed by lymphoma, followed by cancer of the lip and mouth, followed by bladder cancer, and finally skin cancer. So as you can see, prostate cancer takes pride of place, but many of the other cancers that we have listed here are caused by lifestyle. Jamaican men also have other issues. They suffer from depression. They suffer from erectile dysfunction, which many persons don't even recognize is a major source of stress for our men. Many of our men suffer from what is called midlife crisis, i.e. trying to cope with the reality of aging. Many of our men suffer from musculoskeletal injuries, especially at the workplace, and other related injuries due to unsafe work practices and unsafe workplaces. And many of our men suffer from dementia. So as you can see, the list of problems that Jamaican men suffer from is long and worrisome. But the take-home point this evening, which I want to share with you, the listeners, is that most of these conditions are eminently preventable. And we are going to spend the next 2 hours talking about these conditions, explaining to you what's happening on the ground and why our men are succumbing to these particular problems. And oftentimes, this is because of ignorance and in many instances due to unhealthy lifestyle. You're listening to IRFM and this is your late night show. It's called Sex-Wise. I'm your host, Dr. Alverston Bailey. And tonight we're looking at male sexual issues and risk factors for poor health in our male population. We'll be joined about 9:30 by Dr. Keith Wedderburn, consulting urologist from Montego Bay. And we'll be fleshing out these issues to try and clarify some of the causes, some of the intervention strategies, and some of the treatment options that is available to help our men to cope with these particular problems. Now, one of the most important issues that we're going to discuss in a little while, of course, will be some of the risk factors that men need to be aware of that causes them to become unhealthy. We're going to take a short break. We'll be right back.
Ezekiel, you love me?
It's the woman.
All right. Welcome back. You're listening to IRFM, and this is your late night show. It's called Sex-Wise. I'm your host, Dr. Alverston Bailey, and we are looking at men's sexual health and sexuality tonight. We We'll be joined around 9:30 by Dr. Keith Wedderburn, who is a consulting urologist from Montego Bay, who will be asked to clarify a whole raft of issues relevant to men's sexual health and sexuality. We're going to just open the lines briefly to ask you to answer the question, what can we do to encourage men to adopt healthy lifestyle and prevent chronic non-communicable diseases and cancers? What can we do to encourage men to protect themselves from all the various diseases I just mentioned, to protect them from prostate cancer, to protect them from HIV, to protect them from strokes and violent related deaths? So the lines are now open to invite you to share with us for the next 10 minutes or so your thoughts about what we can do, both as men and women, to encourage our men to protect themselves and to promote good health. The lines are 974-5051, 974-5079, 974-5043, and 1-888-991-4152. This is IRFM, and of course, this is your late night show. It's called Sex Wise. Let me just remind you, folks, because it's something that needs to be reminded, that the commonest cause of death of Jamaican men are assault and accidents, followed by falls, drowning, burn and poisoning, and of course suicide. This is followed by strokes, diabetes, cancer of the prostate, heart disease, hypertensive disease, cancers of the lungs and larynx, chronic lower respiratory disease, human immunodeficiency virus, and other heart disease. The lines are now open. Tell us what you think. What can we do as a society to protect our men from these illnesses? The numbers to call are 974-5051, 974-5079, 974-5043, and 1-888-991-4152. It's IRFM, and this is Sexwise. Now, folks, I want to share something with you which I think deserves to be looked at. What are men really doing to make them so susceptible to all the illnesses we just mentioned? Well, a study done by Professor Wilkes and his colleagues at the University of the West Indies has shown in a Jamaica Health and Lifestyle Survey 2007 to 2008 that 15% of Jamaicans smoke, 12% of Jamaicans have high cholesterol, of which 8% are males and 16% females. 25% of Jamaicans suffer from high blood pressure. That is a quarter of the population. Now, when you look at physical inactivity, 48% of men exercise and only 43% of women exercise. When we look at obesity, which is overweight and extreme overweight, 25% of the population is obese, of which 12% are males and a whopping 38% are females. When diabetes prevalence was looked at, 8% of the population suffers from diabetes. That's 8 out of 100. Now, when we look at alcohol intake, the amazing study showed that 65% of Jamaicans consume alcohol in moderate or large amounts. The good news from the data is that only about 1% of the population is involved in hard drugs. With respect to sexual activity, interestingly, 64% of men use condoms all the time, but only 41% of women use condoms all the time. And that's a very interesting point. Let me repeat that. 64% of men use condoms all the time, but only 41% of women use condoms all the time. So condoms seem to be primarily used by men, even though one would prefer if you had 100% usage, but only 41% of women use condoms all the time. The study also showed that 20% of the population suffers from depression. That, folks, is 1 out of 5. So we have a large pool of depressed persons in Jamaica. And that explains many of the illnesses that we are going to discuss over the next 2 hours or so. Of the group of Jamaicans that suffers from depression, 14% are males, and a whopping 26% are females. Now, another study or another issue that was raised in the study was the use of ganja or marijuana. And you know, ganja's received pride of place recently since the government is considering decriminalizing ganja for recreational and religious usage. Well, the study shows that approximately 14% of the population uses ganja, and that's significant. Now, of interest also in the study done by Professor Wilkes is the fact that when it comes to health-seeking behavior, that is, individuals who try to actively get health from their doctors or from the health centers or hospitals, they found interestingly that a third of women in Jamaica never had a pap smear. Now that is amazing, since pap smears have been used to detect early signs of cancer for a long time. A third of women in Jamaica never had a pap smear. And also interestingly, the survey showed that 3/4 of men in Jamaica never did a digital rectal exam to determine if they have prostate disorder. I want to repeat that. 75% of men in Jamaica never did a digital rectal exam to determine if their prostate is diseased. And that is extremely significant, since we pointed out that prostate cancer is the 4th leading cause of death of Jamaican men. What this means really is that Jamaican men have a phobia about getting examined for prostate cancer. The other data showed by this study is that a significant number of the population actively indulge in a high-fat diet. And interestingly, 60% of the population use trans fat, which is present in margarine. It also showed that half of Jamaicans fry their foods, and most disturbingly, that 90% of Jamaicans did not consume adequate fruits and vegetables. So based on this study done by Professor Wilkes, it is obvious that there is very good reason why the health of our men has been seriously compromised and resulting in the very alarming statistics that I shared with you. I also want to share some data with you about male sexual activity. We were here last week with Dr. Herbert Gale looking at men and fatherhood, and Dr. Gale emphasized the need to inform our public health intervention strategies by looking at the data as they are rather than our gut feeling. And I want to share with you, listeners, some data about the sexual practices of Jamaican men. Now, many of you who are listening are going to say, I know what's going on. I can predict clearly what the data shows. But I have a feeling that I'm going to surprise you tonight. Because in the survey done in 2008, it showed that 14% of Jamaican men did not have any sex at all during the year. It also showed that 44% of Jamaican men only had intercourse with one partner. And this is contrary to popular belief, where most persons believe that 100% of Jamaican men have multiple partners. The data showed that 44% of Jamaican men only had one partner. 16% had two partners. 18% had 3 to 5 partners. 3.2% had 6 to 10 partners. And 3.8% had more than 10 partners. So there you have it. Jamaican men are not as promiscuous, perhaps, as you might have thought, since 44% only had one partner. Now, interestingly too, what they also found was that 56% have sex more than once per week. We're going to take a short break. We'll be right back.
Ezekiel, you love me?
Taste the passion.
All right, welcome back. You're listening to IRFM, and this is your late night show. It's called Sex Wise. I'm your host, Dr. Alverston Bailey, and of course, we have an exciting show lined up for you. We are discussing men's sexual health and sexuality tonight. During the past hour or so, I sensitized you to some very interesting facts that the 10 leading causes of death in Jamaican men were external causes: strokes, diabetes, cancer of the prostate, ischemic heart disease, hypertensive disease, cancers of the larynx, trachea, bronchus, and lung, chronic lower respiratory diseases, human immunodeficiency virus, and other heart diseases. I pointed out to you that Jamaican men smoke too much, their cholesterol is too high, their blood pressure is too high, they're physically inactive, they're getting too fat, they drank too much alcohol, they smoke too much, are participating in too much hard drugs, they practice unsafe sex. Many of them are depressed, they smoke too much ganja. They were not seeking health providers out in order to address their healthcare needs, and they had too much fat in their diets. But the most important point I want to emphasize is that prostate cancer is the fourth leading cause of death of Jamaican men, and that is very sobering. Are we going to spend the next hour and a half looking at some of these issues, trying to clarify what's going on here, why do we have all these problems, and why are so many preventable illnesses now a major issue in our Jamaican society? And we have been joined in line by Dr. Keith Wedderburn, consultant neurologist, a colleague and friend of mine from Montego Bay, who has been involved in treating men for the past 30, 35 years or so, and who is more than adequately equipped to share thoughts with you about issues having to do with men's sexuality and men's health. Keith, welcome to Sexwise.
Thanks a lot. Thanks very much.
It's good to have you online.
Nice to be here too.
I trust that the evening finds you well.
Well, indeed. I was awaiting your call, yeah? So I'm ready to go.
Right. Okay, Keith, thanks very much. Now, in my introductory remark, I mentioned something which is particularly interesting. Looking at Prof. Wilkes' survey, they found that 3/4 of the men that they surveyed never did a digital rectal exam.
Oh.
And that is quite an interesting piece of data. But Keith, tell us about the prostate. What is it?
Well, the prostate is a gland. In fact, it's a part of a sexual organ that only a man possesses. A woman doesn't have a prostate, yeah?
Okay.
And this organ is located just at the base of the urinary bladder. That's a bladder that stores the urine that is released intermittently when you micturate, when you pass urine. Now, this gland produces a fluid called the seminal fluid that transports spermatozoa, yeah?
Which is sperm.
The sperm is made from the testes, and there are two testes. A man has two testes. And these spermatozoa needs a medium for transport. And the seminal fluid that the prostate produces actually transport these sperm so that it can be deposited in the female's vagina so that they can reach the egg for fertilization. Yeah? Now, the prostate also has some protective function as far as making the urinary tract sterile. It secretes a certain amount of so-called antibiotic then that actually keeps the urine sterile. It normally grows after a boy reaches puberty. It grows rapidly in his 20s, 30s, and the growth slows down. But as a man ages, the gland continues to grow, and it can produce a lot of complaints, chiefly difficult to pass in urine. And as you mentioned earlier on, the prostate can become cancerous, which is really not a good thing because this can lead to death. Yeah? When the prostate enlarges, there are certain symptoms that the man will appreciate. And things like frequency, he passes urine very often. He has to get up at night several times. He has difficulty passing urine, which is slow. And when he thinks he's finished passing it, he's got to dribble, and it drip and may even wet his underwear. It may even bleed as well when the gland enlarges to a point where the blood vessels are dilated, tends to cause blood, we call it hematuria, passing blood in the urine, yes, which is not a good sign either. And some men will have these symptoms for months and say, well, it's a matter of getting old. And eventually, one night when they go to sleep and get the urge to pass urine, nothing happens. They now have what we call urinary retention.
Thank you, Kid. Now, interestingly, you summarized quite quickly some of the key functions of the prostate, because many men have actually asked me, and they asked me a simple question, Doc, since the prostate gives so much trouble, why don't we, get rid of it? I mean, is it that necessary? Isn't it, say, like the appendix, an organ that we could do without? What is your response to that?
No, my response is that no. This is a major sexual organ. The sperm cannot be transported unless the prostate is there. Ideally, you can have the sperm aspirated from the testes and can be deposited in a female's vagina, or can be passed into an egg, or ISPE, fertilization. But for normal sexual activity, the prostate is necessary to produce the transport medium for sperm.
Thank you, Keith.
Okay.
Thank you. Now, you mentioned enlargement of the prostate. It has this rather fancy name, benign prostatic hyperplasia. What does that mean?
Okay, benign suggests that it is not cancerous, yes? Benign is the opposite to malignant. So whenever the term is, used to describe prostate being benign, the patient can laugh and say, well, I'm happy, I'm glad, all right? Because it's not cancerous.
Okay.
And P is for prostate hyperplasia. Hyperplasia indicates that the cells in the prostate actually multiply. Instead of having, say, a million cells, there may be 2 million, 10 million. So the cells actually increase in numbers. Yes. In addition to, there's another part of the enlargement which is notable. The muscles that are in the prostate hypertrophies. Just like when a man lifts weight and his muscles get large, biceps get big, the prostatic muscles also enlarge as a man gets older.
Okay, Keith. Does it mean, therefore, that all men, if they live long enough, will eventually end up with BPH?
Definitely, but not all men will be symptomatic.
Okay, tell me about that.
Because you see, the gland grows at a different rate in different men. So a man may live up to 90 with BPH, but not symptomatic, because the prostate may not have gotten to that size as yet to cause obstruction to the flow of his urine. Whereas there are some younger men, as young as 50s, the gland grows so rapid that at 50, 55, it is causing obstruction to the flow of urine, and they may need to have something done about that.
Interestingly then, because since enlargement of the prostate is almost inevitable, I gather that it is testosterone dependent. It's based on, it is, the growth is fueled by your testosterone. Now, is there anything that one can do to retard or slow down this enlargement of the prostate?
Yes. Medication can be given to the patient that actually prevents the testosterone that the testes produces from reaching the prostate. Yes? But what may happen that it will affect the man's sexual performance.
Okay.
Because you're actually reducing the testosterone flow, yes? And, testosterone is necessary for man's libido and his performance, yes? So if you're going to reduce that, then you can actually impact on his sexuality.
Well, the question I want to ask you then, are there any markers or any risk factors that you can mention that would make it more likely for you to get prostatic enlargement? Any lifestyle issues that could possibly predispose to enlargement of the prostate?
Yes, it is usually genetic. Men who have their father, grandfather, older brothers with enlargement of the prostate that are symptomatic usually do. And lifestyle as well has a major impact here. Men who consume a lot of animal products, the fats in the diet, can also cause the prostate to enlarge. And men who, don't take in adequate amount of vegetables, yes, fruits, that's another factor.
Okay, thank you. Now, I want to move on to another prostatic problem which we see in younger men, prostatitis. What is prostatitis?
Prostatitis, the term itis signifies inflammation. So whenever there is a prostatitis, there's an inflammation of the prostate. We have similar organs being inflamed, like you have the stomach, we call it gastritis, you have the bladder being inflamed, you have cystitis, you have the joints, knee joints, elbow joints have arteritis, yes? So itis suggests inflammation. The prostate gets swollen, yeah? And there's an increased blood flow to the prostate due to the fact that it is inflamed. And this is a very nice medium in which bacteria can actually flourish. And once the prostate is inflamed, you can get a secondary infection. So not all prostatitis is due to bacterial infection, but it can become secondarily infected. Now, the common thing that we know that can cause prostatitis is what one takes into the stomach. Alcohol is one of the big culprits here. The alcohol causes the prostatic vessels to be dilated, and there's more blood going to the prostate, causing inflammation. Spices such as pepper, curry, yeah, they do the same thing. Men who sit down for long hours in activity, whether due to their job or just the fact that they're lazy, they don't exercise, the gland swells as well. Also, men who have to stand as a part of their job, like shopkeepers or policemen on beat duty, yeah, the gland actually can become swollen. Taxi drivers, for example, these are chaps who sit down for hours from point A to point B, picking up passengers, dropping off passengers, not coming out of the car. They have a high incidence of prostatitis. But prostatitis is not as serious as prostate cancer. Yeah, and it does not lead to prostate cancer.
Okay, Keith. When a man presents with prostatitis, it can either be acute or it can either be acute or it can become chronic. What is meant by acute prostatitis and what causes it?
Well, acute prostatitis is a thing that happens suddenly. Mm-hmm. The man is okay, and he starts having burning when he passes urine. He passes urine very frequently. It may get so bad that he may even have blood in his urine. And some men having acute prostatitis, the older men, may end up having urinary retention. Now, what causes acute prostatitis? Acute prostatitis can be due to consuming, for example, several bouts of alcoholic drinks, or having a spicy meal, yeah? Men who, for example, during sexual activity, they get sexually excited to a point where they need to ejaculate and do not ejaculate. That increase secretion of the prostate that should be eliminated stays in the prostate and can cause prostatitis. I've seen men, for example, just getting married and they go on honeymoon, and these guys have intercourse and they end up having prostatitis.
You know, Keith, it's interesting that you mentioned that because, you know, this show is called Sex-Wise, and we like to educate persons about sexual issues.
Yeah.
And just tongue-in-cheek, what you just said is quite interesting, because you said if a man becomes sexually excited and it doesn't progress to ejaculation,
right,
and the prostatic secretions accumulate in his prostate, he can end up prostatitis. Indeed. Therefore, one could argue that perhaps failure to assist a man in achieving is sexual gratification, especially in a committed relationship, is a risky thing. It's almost a form of sexual abuse.
That's correct. I agree. I agree too.
You know, the ladies won't agree, but you're telling us that if you don't help the man to achieve a sexual release, his prostate becoming large, and it can lead to prostatitis.
That's right. In fact, what I've also seen, young boys who watch pornography, yeah. Mm. They watch and they get excited, they don't ejaculate, and they end up with prostatitis. I've seen teenage boys coming to me, prostatitis.
My goodness, yeah. That's interesting. That's the downside of pornography.
Indeed.
Now, in terms of, you mentioned something which which is very important, is that prostatitis, therefore, is not necessarily a sexually transmitted disease.
That's correct. It's not.
And it's a misunderstanding that needs to be clarified, because most persons believe that if your prostate becomes inflamed, because it is associated with the urethra, that you might have perhaps picked up some kind of STD, but you're now saying there's so many other factors that could predispose to inflammation of the prostate.
That's correct. But STI forms a small percentage of the causes of prostatitis. Yes? For example, if the man, say, gets gonococcal urethritis, gonorrhea, and it's not treated properly, then the bacteria can migrate to the prostate.
Okay.
Similar chlamydia, yes? But these are instances where the patient keeps infection for a period of time, not on the treatment, yes? And the bacteria will progress into the prostate.
Excellent. Now, Keith, with respect to chronic prostatitis, now, why does it progress from the acute stage to the chronic state?
Well, the prostate is such a beautiful organ. It actually heals itself.
Okay.
So if you abuse the prostate by, say, drinking alcohol, it gets inflamed, you discontinue drinking alcohol, within 3 or 4 days, the prostate heals itself. Similarly, if you take you eat a spicy meal, and for the next 3 or 4 days you do not eat anymore, the gland will recover. But if you continue to bombard the prostate with all these irritants, yes, and the gland becomes chronically inflamed. Yeah, for example, if you use a hammer to hammer your arm, yes, it gets swollen. Yes, there's no cut, but the gland, the arm is swollen and it's tender. That's an inflammation. Now, if you rest it for a while, the swelling goes down, the pain goes away, and you're fine. But if you persist in hammering your muscle, your arm, then it will become chronically inflamed, and it's very hard to get rid of, similar to the prostate. Because when it's chronically inflamed, I mean the blood flow increases, and this is a chronically inflamed prostate.
Interesting, Keith, because you mentioned the whole issue of, and now I've coined a term called prostatic abuse. You are telling me that many of the lifestyle issues that I mentioned at the introduction to the program suggests that unhealthy lifestyle, like inappropriate diet and smoking, excessive alcohol consumption, can in fact cause prostatic inflammation. And if you continue along that pathway, it can result in chronic prostatitis. How does it present itself?
Well, usually it presents with urinary symptoms, yeah? The patient has increased urge to pass urine. He may have burn when he passes urine. He will have low back pain. Pain in his lower back. Pain going down his thigh, down to his knees. Yes. You find that he's not performing as he should sexually. He is what we call, he slows up a bit. He doesn't get a hard enough erection. And in fact, when he does ejaculate, he may have premature ejaculation. Instead of going the length of his stay, he will, maybe in a minute or so, he discharges, he ejaculates. Yes? And some of these men who have chronic prostatitis with also an enlarged prostate, because you see, if a man gets older, like in his 50s, he also has an enlarged prostate. When the prostate swells up or gets inflamed, it may push him over into urinary retention.
Okay.
Yeah?
So chronic prostatitis can lead to urinary outflow obstruction.
Indeed.
Okay. Interesting stuff. Perhaps I'll just ask you then to comment on how you treat prostatitis.
Well, it's best to educate men how to prevent it, yes? And prevention goes farther than treatment, because it's easier to prevent than to treat, because sometimes prostatitis is very difficult to treat. Some men are on treatment for weeks, some for months, before getting some improvement. Now, you educate them about the lifestyle, what not to eat, how they should exercise, not to sit for long, not to stand for long. And whenever the condition is diagnosed, we normally offer them anti-inflammatory agents, and these anti-inflammatory agents are medication that reduce swelling and also reduce pain. And there's a group of drugs called NSAID,
which are non-steroidal anti-inflammatory drugs.
That's correct. Yes, these drugs are very good in reducing swelling and inflammation. Now we also add antibiotics because whenever the gland is inflamed, it's a very nice medium in which bacteria can grow and flourish. So we try to give them antibiotics, sometimes more like a prophylaxis. Yes, but if there's any suggestion based on investigation, because we can do testing. Bacteriological testing to see if there's any bacteria that is there, yes, and if there's bacteria, then we use antibacterial as well.
Okay, I know that sometimes men are encouraged to ejaculate often in order to reduce inflammation of the prostate. Is that still a current treatment option?
Well, I tell you, one has to be careful because you can underdo it or overdo it. Yeah?
Yes. Mm-hmm.
Yeah, because one of the causes of prostatitis is excessive ejaculation.
Now, why is that so?
Yes, because you're actually irritating the prostate, yes, to ejaculate.
Let me pause there, Keith, because you did say that prostate has some muscles in it.
Right.
And when you ejaculate, the prostate contract, doesn't it?
It does contract, yeah.
And so you said repeated contraction can cause inflammation.
Yeah, but remember now, whenever the prostate is being stimulated, it's slated to produce a fluid, a prostatic fluid.
Mm-hmm.
So if you're going to stimulate, because it has glands, and these glands, when you keep on stimulating glands to produce fluid, then the glands will become inflamed.
Okay.
Like any glands in the body, like your salivary gland, if you're using something to increase salivation, then your parotid glands or whatever salivary glands can become inflamed. I mean, your stomach, if you're putting any acid in the stomach to produce extra acid, it can become inflamed. Same with the prostate.
And that's called gastritis.
Gastritis, right. So if you're going to be irritating, stimulating the prostate on an ongoing basis to ejaculate, then the glandular portion of the prostate will become inflamed.
So you're saying,
not muscular part.
No problem. You're saying that hypersexuality does have its disadvantage.
Right.
In that it could lead to prostatitis.
Yes, that's right. That's obvious. However, it's best to find an average. So I said 3 times per week. Yes. That's 3-4, but not 7 days a week. Yeah. So you have to strike a medium here. Yeah. Because on the other hand, men who, for example, decide to abstain from sex for any prolonged period, and during that time they're being stimulated, then that's a problem. The prostate becomes inflamed.
Okay.
But if they abstain.
Yes.
And they're not being stimulated.
Okay.
They're fine.
So the key point here is that if you are celibate,
that's correct,
and you want to minimize the risk of prostatic inflammation, then you ought to avoid sexual stimuli.
That's correct.
Okay. But if you're celibate and you are being stimulated either visually or using some other means, you are exposing yourself to the risk of prostatic enlargement and prostatitis. Very good discussion, Keith. I'm going to ask you to pause a moment. Let me just recognize you. This is Dr. Keith Wedderburn, consultant urologist from Montego Bay, a friend and colleague of mine who has had almost 40 years of experience treating men with urinary tract problems and with problems of the bladder and of the prostate and of the kidney. You're listening to IRFM, and of course, this is your late night show. It's called Sex Wise. I'm your host, Dr. Alverston Bailey, and we just want to remind you that around 10:30, we're going to invite you to join in the discussion where you can call us and, share your thoughts with us. The numbers to call us then would be 974-5051 9745079, 9745043, and 1-888-991-4152. You're listening to IRFM, and this is Sexwise. We have online Dr. Keith Wedderburn, consultant urologist, who's discussing matters having to do with male sexuality and male sexual health, and we have looked at the prostate, which seems to be prone to a raft of challenges and problems. We look at enlargement of the prostate, called benign prostatic hypertrophy. We look at prostatitis, which can be acute and chronic. And now, Keith, I want you to talk to me about this biggie, prostate cancer. What is prostate cancer?
Well, prostate cancer is really cancer of the prostate gland. And cancer is the malignant alternative to benign. Benign is when the gland enlarges. It's an aging process, and the gland is just enlarges. But when it...
Okay, I think we have temporarily lost my guest. I think we'll be reconnecting with Dr. Keith Wedderburn in a jiffy. You're listening to IRFM, and this is the late night show. It's called Sexwise. I'm your host, Dr. Alverson Bailey, and we're looking at male sexual issue, and we're trying to address some of the common problems that men have with their sexual organs and its impact on their sexuality. Dr. Wedderburn's back on line. Welcome back, Keith. Oh, he's not back on line yet. Okay, no problem. We have a caller on line. Caller? We seem to have lost that caller. Okay, no problem. So we are looking tonight at male sexual issues and some of the problems that men have to contend with in order to maintain their health. And we are going to be looking at prostatic disorders. We're going to be looking at erectile dysfunction. We're going to discuss the small penis syndrome. We're also going to be talking about andropause or male menopause. We'll talk a bit about midlife crisis, and we are going to talk about testicular cancer, which is cancer of the testes. And these are all some fairly common issues that seem to affect men and which we really need to spend some time talking about. Because in the introduction this evening, we mentioned that there are a whole raft of activities that men participate in, which has adverse effect on their health. Men smoke too much, 14.5%. Their cholesterol level is too high, 12%. Men have too much high blood pressure. They're physically inactive. They're too fat. They have diabetes. They drink too much alcohol. They take too much drug, and they practice unsafe sex. We have Dr. Wedderburn back online.
I'm back with you.
Thank you very much, Keith. We were discussing prostate cancer.
Yeah.
You were saying prostate cancer is a malignancy.
Right.
What is meant by that?
Okay, malignancy. These are normal cells, cells of an organ. Mm-hmm. But instead of remaining in the organ, these cells can move to other areas of the body.
Okay.
They can spread. So as opposed to a benign cell, benign prostate, the cells remain in the prostate. But once it becomes malignant or cancerous, it can spread. It can go to other. It goes to the bones. It goes to the liver. Goes to the lungs. It goes to the brain. Yes. So that's a hallmark of cancer. Cancer are cells from a particular organ. Yes. They don't remain in the organ. They move out, and that's why they're cancerous.
Okay. Could you pause for me, kids? We have a call online. Okay, caller, welcome to Sexwise.
Good night.
Good night to you, sir.
Yeah, man. Good night to you, Doc.
Good night to you, sir.
I just want to ask you one question quickly, but I will listen to the answer. What about if you have sickle cell? Because I have sickle cell, and sometimes I really have great problems about it, because sometimes I have erect and... Do you understand?
No, I don't understand. Tell us what happened. You get erection
I have trouble with sickle cell.
So do you have a condition called priapism where you get an erection and it can't go down?
Sometimes I have lower back pain and all kind of stuff. Sometimes I get erect and take long to go down, and sometimes when I'm having sex, it's like, I can't spend a long time.
All right, Keith. This gentleman seemed to have two problems, which is quite interesting. Okay. He mentioned that one, he gets an erection that he can't go back down, and then he also complains of erectile dysfunction. I mean, premature ejaculation, rather. Priapism, is a big issue in sickle cell disease, isn't it? Tell us about that.
Well, okay. Priapism is a condition in where the penis gets erect, not due to any sexual stimulation. So you find that the man will be there, goes to bed, wakes up in an erection, and it doesn't go down at all. Yes?
That must be very painful.
Yes. In fact, this condition affects men who have sickle cell disease very often. So you find young boys, teenage boys, young men with sickle cell disease, they are at risk of getting priapism. Men who have some other condition like lymphoma, which is a cancer of the blood cells, they can also get priapism. Men who use sexual stimulant, there are certain sexual stimulants that can be used to precipitate and bring on priapism. Now, even those medications that are given as for men who have ED, erectile dysfunction, PDE5 inhibitors, like the regular tablets you buy at the pharmacy for erection, that's one of the complications.
Keith, could you pause there for me? Because could you define for the listeners what you mean by priapism?
Okay. Priapism is erection that is brought on without sexual stimulation that persists as much as 4 hours or more.
Oh, as long as that, huh?
Yes.
Okay.
So it's not just an erection that will come up and go down after ejaculate. And many of these men, they decide to have sex intercourse, they ejaculate and the penis remains erect.
Okay.
It doesn't go down after ejaculation because normally when a man ejaculates, the penis goes flaccid. But whenever there is priapism, the erection does not disappear. It persists.
What are the risk factors for the man if the erection... there's some men who will tell you that I don't have a problem with having an erection that lasts for 6 hours. Is there some risk to having such a prolonged erection?
Yes, the risk is that the muscles in the prostate, in the penis, and the blood vessels, because the vessels have to dilate for blood to flow into the penis and constrict to let blood out when the penis goes flaccid. These muscles can be damaged and become fibrous. And by fibrosis, they become like fibrous tissue.
You mean they become hard? They become hard?
Become hard.
Okay.
And they no longer can relax and constrict. So these men are at risk of getting erectile dysfunction. They will not be able to get erection after a while.
Therefore, priapism, therefore, is not a desirable state.
No, it's not.
Okay, thank you, Keith. Could you go back to prostate cancer then? Tell us what's the prevalence in Jamaica, because it has been said that we have one of the highest prevalence rate of prostate cancer in the world. Is that true?
We still do, yeah? But the original study that was done in the 80s, where we were told that we are about 220 per 100,000. Okay. That has been downgraded to about 120. And just recently, I was at a meeting, and we got some data from Trinidad. And Trinidad also has a high incidence. So there's a high incidence, the American, black African American as well, yeah? And it seems that the Africans, the black men, we have a high incidence. And this is based on the fact that a gene, a cancer, prostate cancer gene, is found in some men, not all men, who have prostate cancer. Yeah, and it's a thing that runs in families. So if you have a person, a grandfather or your father who has had prostate cancer, you are at increased risk of getting this condition. That is why it's very important for you to know your family history and for you to get tested. That's
very worrisome, kid. Tell me, who is at risk of getting prostate cancer apart from race? We know that people of African extract tend to have a higher risk. Are there any other risk factors for prostate cancer?
Well, usually, it's an aging process as a man ages. Yes, because it's a testosterone-based disease. If the testes are taken out, say at an early age, the man won't get prostate cancer because once there's no testosterone, there's no prostate cancer. So once you have functioning testes, you're at risk of getting prostate cancer. And as you get older, so it's a disease of aging.
You know, the reason why I asked, because you mentioned that there seemed to be a prostate cancer gene, and say if one knows that prostate cancer runs in one's family,
that's correct.
Is there anything that one can do to at least retard the development of this particular condition?
In fact, yes, you can. You can, and that is where exercise plays a big role. Men who are active, yeah, even if they are destined to get prostate cancer, they'll get it at a later age.
Okay.
Yeah? Similarly, if you reduce or decrease the amount of animal fat in your diet, you can also delay the onset of prostate cancer. You may get it, but you'll get it later. So men who are destined to get prostate cancer due to their genealogy or their family trait, if they consume excessive animal products, or if they do not consume adequate amount of vegetable and fruits, if they live a sedentary lifestyle, these men will get prostate cancer earlier, maybe as early as in their 50s, rather than later in their 80s. Because, if you follow men on a whole, the prostate is a thing that goes cancerous. So if I collect 100 men who are, say, 90 years of age, and take out the prostate and dissect it, and
oh my goodness, I think we have lost Dr. Wedderburn again, but we will try and reconnect with him in a short while. You're listening to IRFM, and of course this is a late night show. It's called Sex Wise, and I'm your host, Dr. Alverston Bailey. And we are discussing male sexual issues, and we were having an interesting discussion with Dr. Wedderburn about prostate cancer. And he pointed out that the prevalence rate of prostate cancer in Jamaica is fairly high, about 120 per 100,000. And Trinidad and Tobago seem to be following in close pursuit to us. But even if you have the prostate cancer gene, you can delay the progression and development of this particular condition by exercise, by paying particular attention to your diet, and of course, if one looks at the whole question of prostate cancer, we know that cancer is initiated usually by some chemical or some environmental pollutants. We know that it is oftentimes promoted, and then it moves on to progression. So I think we have Dr. Wedderburn back online. No, not yet. We're going to take a short break. We'll be right back.
Ezekiel, you love me?
Ivy.
Ezekiel, you done marry me again?
Ivy.
Calling all schools in Western Jamaica. City Sport.
Welcome back. You're listening to IRFM, and this is your late night show. It's called Sex Wise. I'm your host, Dr. Alverston Bailey. And tonight we're looking at male sexual issues and male associated problems that might be impacting negatively on their health. And we have been having an interesting discussion with Dr. Keith Wedderburn, consultant urologist who hails from Montego Bay, and he has had over 30-odd years experience dealing with men with associated problems of the prostate, the bladder, and the kidneys. And of course, we were looking at prostate cancer, and he made an interesting point which I want to emphasize. That prostate cancer is fairly common in Jamaica, 120 per 100,000. But even though you might have a genetic predisposition to prostate cancer, even though your father and grandfather and uncles might have prostate cancer, you might delay the manifestation of this particular problem if you follow some simple advice. If you conform to an appropriate diet and you exercise regularly. And I just want to mention to you that in countries where there's a high intake of animal fat, there are also high rates of prostate cancer. And high intake of red meat, such as beef and processed meats, has been shown to be correlated with increased rates of prostate cancer. So you need to pay particular attention to your dietary intake in order to minimize the possibility of developing prostate cancer. Is Dr. Wedderburn back online?
Back with you.
Okay, Keith. Welcome back. We have again online Dr. Keith Wellborn, consultant urologist from Montego Bay. You were explaining, Keith, that even though you might have a genetic predisposition, that regular exercise and appropriate diet does seem to help to slow down the process.
Indeed.
And
prevent it. It slows down the process. You'll get it, but eventually at a later age.
Okay.
Yeah. Because these modalities, proper exercise and proper diet, what it does, in fact, it delays the onset. Because even if you're destined to get prostate cancer, it will delay it. Because these things they don't actually cause prostate cancer. They actually bring it on earlier. Yeah, they're not really cause of prostate cancer, because presently we do not know what is the cause of prostate cancer. We know there are certain things that are related to prostate cancer. Yeah, we know, for example, that it's a thing that happens as you get older. So with aging, yes, we know that thing that is related to the prostatic cancer gene. We know that's also related to diet. We know that it's related to exercise, the activity. But we cannot say these are the causes of, yes? But what we know, if men get their regular checkup, they get their testing, there's a DRE plus a PSA, then the doctor will actually diagnose the cancer in its early stages. And the good news is that this cancer can be cured. So if you are getting your testing done, testing will not prevent from getting prostate cancer, because some men feel that if they go to their doctor twice a year, get their DRE, get their PSA, they will never get prostate cancer.
That's digital rectal exam.
Right.
Okay.
Yeah, they claim that once they get their examination and do the testing, they'll never get prostate cancer. But the fact is that the cancer can be diagnosed and picked up much earlier when it can be cured, rather than stay away, don't get tested until you start having symptoms, and that is actually the late stages. And we cannot cure you then, we can only treat you.
Okay, so therefore, Keith, you're emphasizing the benefit of screening tests like digital rectal exam.
Indeed.
And PSA. What is the PSA?
PSA, P stands for prostate, S is specific, and A is antigen. It's a protein that only the prostate gland produces. And this protein spills into the blood. So when the blood test is done, the level of the PSA can be measured, and there are certain normal values that we go by. And if the value is above what is normal, then it sets up a red flag. But it does not say the man has prostate cancer. So if you go to your doctor, you do a PSA, the result comes back high, it doesn't mean you have prostate cancer. It just alerts the doctor that something's definitely wrong with the prostate.
Okay, Keith, why are men reluctant to go to the doctor to have the prostate examined?
Well, there are several issues here. Yeah? Some men figure that something's going to kill them anyway. So why should they go and hear that they have prostate cancer? You know?
Okay, yeah.
Yeah? And the other thing is that, we live in a homophobic society, and men figure that once they are examined rectally, they're being breached and they're being converted. Yeah, and they just don't like that idea.
Okay, are you suggesting to me that some men believe that a digital rectal exam is a kind of loss of anal virginity?
That's correct.
Okay,
That's what they think. That's what they think.
Okay.
Yes, that's what they think.
So what can you do to debunk that myth right now? Tell the men what they should do.
I tell you, the anus is another orifice similar to the mouth, similar to the nostrils, similar to the ear, through which your doctor can diagnose conditions. You go to the doctor to open your mouth. He puts a spatula on your tongue, said cough or said ah. He looks at your throat to see if there's anything wrong with your tonsils. Look to see if there's anything going on there. He looks up your nostril, he looks into your ear to see if there's anything wrong. Well, the anus is another orifice where things can be diagnosed, not only prostate conditions, but anal sepsis, anal fissures, hemorrhoids, polyps, anal cancers. These can be diagnosed during a rectal examination.
Keith,
okay?
Many men believe that prostate exams are painful. Is that true?
Well, it can be painful, because if you are having a bowel action and the feces is hard, where coming out, it can cause pain in your anus.
Yes.
Yeah? So it's hard. Now, the astute examiner can actually perform the examination so that it won't cause a lot of pain. Because based on how the patient lies on the couch, the way he breathes, yes, proper lubrication of the examining glove finger, yes, and there are certain techniques that can be performed, and it has to be done quickly. It doesn't make sense you're there as the examiner, minutes examine this patient, because it's not a normal thing for a finger to be up in the rectum.
In other words, Keith, what you're saying is that a digital rectal exam is essentially a pain-free and a quick exam.
It is. In fact, I tell my patient that it's faster than Usain Bolt's world record 100 meters. Because you know what you're feeling for, bam, 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 you're through.
There you are.
If the prostate is inflamed, yes, it can be tender and painful. If the man has anal condition like a fissure in the anus where there's a cut in the anus, yes, or if he has any hemorrhoid that has strangulated or anything there, then it can be painful. But once there's no perianal or anal condition, if the prostate is not inflamed, then it's a pain-free procedure, and it's very quick.
Okay, Kid, if a man comes, and I've sent a number of patients to you, yes. If I see a patient with a high PSA, and you could remind us of what numbers you mean by high?
Well, the normal value is 4 and under. Well, and it also depends on the age, because the younger the man is, the closer the PSA should be to 0.
Yes.
So if a man is under 50, the normal value for PSA should be not more than 2.5.
Okay.
So even though the lab will say 4, once he's 50 and younger, you should not go over 2.5. Above 2.5 is abnormal.
Right. Now, if a person presents, if his family physician does a PSA and it is higher than normal, what advice would you give the doctor with respect of disposing of that patient?
Well, first of all, the doctor should examine the prostate. If there's any sign of inflammation, then that patient must be treated with an anti-inflammatory agent and an antibiotic for about 10 days, and having finishes completed treatment, he needs to repeat the PSA. If the elevated PSA was due to prostatitis, which does happen, then the PSA value should go back to normal. If the prostate is a very large prostate, and the patient has obstructive symptom that is urine is stopping, he can also have a high PSA due to a large prostate. Yeah? So there again, the gentleman, the patient can be given medication to improve the flow of urine, yes, yeah, but this PSA will not go down because the prostate is large. Here is where you need a urologist to determine whether this person needs a biopsy. A biopsy means taking a piece of the prostate to look on the microscope to see if there's any cancer cells in that biopsy.
And if cancer cells are found, what happens?
Once cancer cells are found, then other investigation needs to be performed, just like a CT scan or MRI, and a bone scan to see if the cancer has spread to distant sites. If the prostate cancer has not spread, if it is completely confined to the prostate, then this person can be cured of his cancer either by radical surgery where the entire prostate is taken out, or the prostate can be irradiated, given a radiation treatment to cure the prostate cancer.
The important take-home point then, Keith, is that if prostate cancer is detected early, it can be cured.
It can be cured.
All right. Tell us quickly about testicular cancer, because that's a cancer which we hardly ever hear about.
Yeah, well, testicular cancer is not very common in Jamaica. Not very common at all, but it does happen. And usually it presents with a lump on the testes. The testes are two, right and left, and they're very symmetrical, they're smooth, yeah? But once there's a additional lump attached to the testes, that's a red flag. Most additional lumps in the scrotum are not cancerous.
Okay.
They're cystic, yes? So
which is a small sac filled with fluid.
That's right.
Right.
Yeah, but it's very difficult for one to appreciate whether it is cystic fluid or hard a mass. Yes, and then we have to send for an ultrasound. So once the patient is examined, the person is sent for an ultrasound exam, to scan the scrotum, and this will detect whether the swelling that is there is fluid or tissue. If it's tissue, then definitely that needs to be removed, because tissue in a mass, right, in the testes, is cancerous until proven otherwise.
What's the treatment for that, if it is cancerous?
If it's cancerous, usually we remove the testes and offer plus or minus radiation or chemotherapy. But removal of the testes, we call it orchiectomy,
yes,
yeah, is a treatment of choice.
That sounds fairly drastic. Could you just take out the lump alone?
Well, no, because cancer, you see, once we deal with cancer,
yes,
it spreads locally. So if you just excise that cancerous lesion from the testes,
you'd have left some cells behind.
At risk, yes. And you're going to open the skin as well, and you actually causes cancer as a seed on the skin. So you actually convert a locally confined cancer to a metastatic cancer because it actually spread out to the wound.
Okay, Keith, we're going to open the line shortly. You're listening to IRFM, and this, of course, is a late night show. It's called Sex Wise. I'm your host, Dr. Alveston Bailey, looking at male sex issues and male-related health problems. We have online consultant urologist Dr. Keith Wedderburn, who hails from Montego Bay, and he's sharing his thoughts and his experience with us about how to recognize and treat male-related genital problems. The numbers to call us now. The lines are now open. You can call us on 974-5051, 974-5079, 974-5043, and 1-888-991-4152. This is Sex Wise. I'm your host, Dr. Al Bailey, and we are talking about male-related sexual problems. Now, Keith, I want you to talk to me quickly about the small penis syndrome. Is that a real issue in Jamaica?
Well, you know,
I mean, Jamaican men really complain bitterly that they're too small, you know.
Yes. I've had patients of all age group, from the teenager right up. The mother takes the son in and says, "Doc, my son's penis is not growing, and I'm concerned that his penis is too small."
Give me some good news, Keith. You can make it about twice the normal size, can't you?
As a urologist.
Yes. Yeah, you can work some magic.
Well, I tell you, I mean, there are a lot of claims that penis can be enlargement, yeah. But you know, I recall going to a seminar once, and I was speaking to some young men, yeah, and they said, "Doc, we know how to enlarge a penis." I said, "What? Tell me about it." They said they had a friend who went out and beat his penis against I think a papaya tree, and it enlarges.
After it became swollen.
So what you do when you do that, you actually damage a penis.
Yes.
And it remains semi-erect. So there's always blood in the penis, because when the penis is flaccid, it is smaller than when it erects. Erection causes the penis to enlarge and leaden.
Could you hold a point? Keith? We have a call online. Okay, caller, welcome to Sex Wise.
Good night.
Good night to you. So we have Dr. Wedderburn online. You can ask us any question.
Yeah.
Go ahead, sir.
What feeling like when it frustrates you?
What was the question, sir? What's the feeling like what?
What you have you could give me any experience like what feeling frustrate give you?
Oh, you mean when it is enlarged? Or when it is infected?
When like if it is coming on you, like, all right, I feel like a small pain sometime.
Okay. Where are you feeling the pain?
Sometime like me.
Yes.
Into my balls, like.
In your testes.
Yes.
Okay. So your testes are uncomfortable.
Repeat, please.
Your testes are painful.
Yeah.
Okay. Are you wondering?
Sometimes even like if we have sex like after my discharge now, it kind of a little bit painful.
What is pain? What is painful? Your testes?
No, my private himself.
Your penis. Okay, Keith, you want to take that on?
In fact, I wasn't able to hear the question.
Okay, he's arguing. He said that he has some discomfort in his testes when he ejaculates, and he also has some discomfort in the shaft of his penis when he ejaculates. So he's wondering if it is his prostate that is giving him trouble.
Okay. Well, painful testes during and after sex is not uncommon. And men, for example, who get an erection but do not ejaculate can have painful testes. You know, you go to a party, you have close dance with your partner, you get erection for an hour or so, and you do not ejaculate. You have painful testes. This is a normal, natural phenomenon. Yes. Now,
could you pause me, Keith? Caller, do you have a radio on?
Okay.
I'm getting some feedback.
Okay.
Could you turn it off for me, please?
Yeah, it's off.
Okay, go ahead now, Keith.
yes, I was saying that a man who gets a prolonged erection can have pain in his testes. It's a normal phenomenon. That does happen to the man. Yeah?
You see, like,
for it to happen,
if you have...
hold on, caller. Let Dr. Brendan finish his point. Yeah, please go ahead, Keith.
to have pain when you ejaculate,
yes,
I mean, there's something definitely wrong with the testes. Yes? Are they swollen? Do they feel hot? Do you have a fever? It could be orchitis. Orchitis means inflammation of the testes. Yes? Now, the pain during ejaculation in the shaft could be something wrong with the urethra. You could have a urethritis or a prostatitis as well. A prostatitis can cause a referred pain along the shaft of the penis.
Only point, Keith. Caller, are you hearing what the doctor is saying?
Yeah.
Okay, he's saying that if you have pain in the shaft of the penis, that is the tube, it could be because the tube itself is inflamed or your prostate might be inflamed. Do you have any other question?
Okay. If, like, suppose it is not me, it's one of my friends.
Uh-huh.
Considering about something, but you don't have a card to call. It's sure if the person is of it, but if you have sex with somebody that have, like your mind tell you that the person have an induced condom and it don't burst, you can infect it.
If your mind tell you what?
If my friend said if him have sex with somebody, like him mind tell him because him hear about, but you know, sure. And if him use like a condom, him can infect it.
What did his mind tell him?
No, in here, after I'm done have sex with the young lady.
Yeah, man.
After I'm done have sex with the girl.
Yes.
In here, same have AIDS, but in did use.
Okay, I follow. Yeah, the Keith is saying that after he had sex with the girl, he heard that the girl had HIV. And so he started to develop all kind of urethral symptoms.
Okay.
But I suppose that's understandable.
Yeah.
Sir, we're going to have to run now, but thank you very much for your call.
All right.
And thank you very much indeed. You're listening to IRFM, and of course this is Sex Wise. I'm your host, Dr. Alverson Bailey, and we have online Dr. Keith Weatherford, who's here to share his experience with us about men's sexual health and sexuality. Now, Keith, you were talking to us about what treatment options you have for the small penis syndrome.
Yeah.
And what were you saying?
Well, okay. If it's a young chap, you know,
yes,
we can do hormone studies to see if his hormones are normal.
Yes.
Because hypogonadism, due to decrease in the production of hormone, testosterone and other hormone, can result in the abnormal growth of the penis.
Yes.
Which is a fact. Yeah. But an adult male who during his puberty years, it was okay, and now when he's 20s, 30s, he claimed that he's small, yeah? Maybe what he does, he's actually comparing. And usually penile size is the same in families. So if your father had an average size penis, don't expect to have a very large penis more, you know? It's the running family. And whenever a man looks at his penis, if he stands up and looks down, it looks shorter than if he turns to his side and looks in the mirror. Yeah? Because looking down is actually will look shorter. Yeah? It doesn't really reveal the entire length of the penis.
Okay, could you pause for me, Keith? That's called mirror work. We have a caller line. Caller, welcome to Sex Wise. We have lost a caller. Caller? Oh, we have lost the caller. Okay, Keith, you're actually suggesting that for men who believes that their penis is small, they should do mirror work.
That's correct.
Okay, so that...
Stand to the side of the mirror from the side instead of looking down on the penis.
But seriously, Keith, suppose a man says, listen, I know, I understand, but I really want to get larger. Can you help him?
Well, Well, there's certain operation, and what the operation does, it actually removes the ligament, because the penis is actually held up against the pubic bone. You know, there's the pelvic bone, that pubis, by ligament. Yes? And if the ligaments are taken down, that will actually provide an extra length to the penis. But the problem is that it will not get up to 12 o'clock that it used to. It will erect. But for it to go up in the air, you'll have lost that ability, because once the ligaments are taken down, yes, the penis will erect, full erection, but it will not go up. Yes. The other thing is that there's certain injections, Botox, etc., that can be used, but there again, you're putting in Botox, which is something to fill. It actually keeps the penis semi-erect. Yeah, yeah. Because most of these so-called agents that are given to enlarge the penis, they actually are keeping the penis semi-erect. The penis is not flaccid anymore. So if the penis is semi-erect, it's going to be larger and it was flaccid. So the patient will appreciate, yeah, man, I have a larger penis. He goes over to a semi-erect penis.
So the take-home point then is that there's really not much that one can do to enlarge the penis.
Right. That's correct.
Okay. Tell us a bit about erectile dysfunction. Is it that common, or is it an overblown concept?
Well, it is common. As a man ages, yes, his ability to get an erection decreases, yes? The Massachusetts study that was done in the States some years ago said that by the time a man gets to 60, he is about 60% at risk of getting ED.
Oh, that's very worrisome, Keith.
Yes, it is. But
for persons
the fact is
my
that,
age.
Yes. Yes. The fact is that erectile dysfunction is an inability to achieve and maintain erection adequate for sexual intercourse. But this is not just a thing that happened yesterday and you're okay again. That thing that has to be consistent for over a year. So most men at times find it difficult to get an erection for whatever reason. When they're under stress, it could be financial stress, it could be spousal stress, it could be they may be fatigued, and they may fail at times, but that's not ED, yes? But ED has to be a consistent inability to get an erection.
And if you diagnose ED, what treatment options is there for men?
Treatment?
Yes.
Well, usually if it's confirmed to be ED, then there are medications that can be given to cause erection, and there are tablets that are available. We call these PDE5 inhibitors, phosphodiesterase inhibitors, which actually increase the amount of blood flowing to the penis, because that is what causes erection. The movement of blood in the penis causes it to rise. So if you can give a medication improve the blood flow, then you can get erection. And this is what these pills are for. Now, if these pills do not work, then there's an injection that can be injected into the penis, which causes instant erection. Yeah, because the injection causes the blood vessels to relax, and blood is pulled into the penis. The other means as well is a vacuum that can be actually attached to the penis, and once the vacuum is activated, blood is pumped, is pulled in the penis. If all these methods fail, then we can actually put in prosthesis. There are rods that can be implanted in the penis to make it safe for the man to be able to have sexual intercourse. Yes? Yeah, and there's also some inflatable prosthesis that can be inflated during erection and is deflated once the man has sexual intercourse, and it will go down.
So the take-home point, Keith, is that there's good news for a man with ED, and that there are many treatment options available that can be tailor-made to suit his particular situation, and so you need not despair. You're listening to IMFM, and this is your late-night show. It's called Sex Wise. I'm your host, Dr. Alverson Bailey, and we're going to take a short break. We'll be right back.
Imagine if every day was a Wednesday, all of your friends there, them on the ends of the bar. You know the
All right. Welcome back. You're listening to Ira FM, and this is your late night show. It's called Sex Wise. I'm your host, Dr. Alverson Bailey, and we have consultant urologist Dr. Keith Wedderburn online, and we're just wrapping up some interesting concepts with respect to the challenges that men either believe they have or do have. And he debunked myths that we can in fact extend the penis so that it can become more effective. And in fact, this oftentimes is a concept that men entertain, which is not shared by their female partners. Right, Keith?
Correct. That's correct.
All right. Now, I just want you to tell us briefly, before we wrap up tonight, about andropause or male menopause. Is that a real issue, or is it a figment of someone's imagination?
Well, the word andropause actually sprang from menopause in women.
Yes.
Yes, they tend to equate andropause and menopause. But menopause in women is different, because the menopause, the woman ceases producing hormones from our ovaries. The ovaries actually stop working. They're out. Yeah? Whereas a man is able to produce testosterone up to the time he's death in his 90s, 100. Once he has testes, these testes are producing testosterone, but in reduced amounts.
Only point for me, Keith. We have a call online. Caller, welcome to Sex Wise. Oh, he left us. All right, no problem. Please continue, Keith.
Yes, so there's reduced production of testosterone. So as a man ages, his ability to perform sexual is going to decrease. Yes? He won't have the symptoms or the signs of hot flashes and irritability and like these, because he still has hormone on board. Yes? And a man can father a child up to old age. Yes? Whereas a woman cannot, because once the ovaries cease functioning, that's it for fertility. But a man is fertile up to 80s. Yes.
I hear you, Keith, but there's some men who believe that with the passage of time, with decreasing their potency, that in fact they might perhaps be going through andropause. But only point for me, please. We have a call online. Caller, welcome to Sex Wise.
Yes, greetings.
Good night to you, sir.
Yes, doctor. Your guest.
Yes, sir.
In one, you know, we heard you said that there is no known, it is not known what cause. And then in the same breath you spoke about cure. I mean, that sounds kind of funny.
All right.
You said, we long upon this, you said it is not known what caused it.
Okay, Keith, could you...
Cure. If it is not known what caused it, how can you deal with the cure?
Okay, Keith...
We long upon this.
No problem. Did you get the question, Keith?
No, I can't hear the question.
Yeah, this caller is arguing that since there's no known cause for prostate cancer, how can you cure it?
Well, it can be cured if it's diagnosed early, because cure, once it is confined to the prostate, you remove the entire prostate, you're cured. If the cancer is picked up early by screening, by doing a regular examination on a prostate-specific antigen blood test, yes, if these two things are abnormal and the biopsy is done, and the biopsy comes back positive for prostate cancer, and all the other tests are done, and the cancer has not spread, then you remove the prostate in totality. And the entire thing comes out, or you can irradiate it, and the person is cured.
I think the concern he has is that, for example, when one think of an infection, you get rid of the infection, so you cure the problem. That's why I got a bit confused in terms, he's thinking that perhaps the cure is to remove the underlying cause.
No, because you're moving the organ that's affected.
Okay.
So once the organ is removed, there's nothing else in the body that can get prostate cancer. You can get prostate cancer in your brain, in your stomach, in your heart, in your lung, in your liver, if the prostate cancer was confined to the prostate and that was taken out.
Okay.
So once the organ is removed, it doesn't matter what else you do. It doesn't matter what else was there. You have the prostate cancer gene still in your body, but there's no organ to become cancerous anymore because it's out.
Thanks very much indeed. Could you just wrap up, Keith, by just reminding us of what sort of treatment options you give men who genuinely have a low testosterone level?
Okay. Well, what I would love to say is that there's a condition called metabolic syndrome. When men have a decrease in their testosterone level and they're obese, Yes, and some of these men have diabetes as well, and their energy level is low. Yes, and I think these symptoms are equate to andropause. Now, these men can be given testosterone replacement therapy, but one has to be very careful. They need to have their prostate checked before, because testosterone treatment can actually speed up the occurrence of prostate cancer. So taking testosterone with prostate cancer can cause rapid spread of the disease. So before you undergo testosterone treatment for decreased testosterone, one has to be certain that there's nothing that will say that you have prostate cancer.
Thank you very much, Keith. And it's amazing how time flies, isn't it? We are actually approaching 11 o'clock. And
right.
I really appreciate you coming on tonight
Most welcome. A pleasure
to join
here.
us. And we definitely will have you back again soon to share your experience with us.
Not a
And
problem.
you have yourself a wonderful night.
You too, and good night, listeners. Have a very good night. Okay,
Thank you. Thank you very much. That was Dr. Keith Wedderburn, consultant urologist from Montego Bay, who decided to spend the evening with us to discuss issues having to do with males, sexual health, and sexuality. It has been a fascinating evening. We have looked at a whole raft of issues. We have looked at the type of problems that men are prone to and pointed out that the sixth leading cause of death for men was external causes: cerebrovascular diseases, diabetes mellitus, cancer of the prostate, ischemic heart disease, hypertensive diseases, malignant disease of the trachea, bronchus and lungs, chronic lower respiratory disease, and human immunodeficiency disease. We also pointed out quite clearly that there are a whole raft of unhealthy lifestyle which predispose to many of these conditions, such as smoking, high blood cholesterol, high blood pressure, physical inactivity, obesity, diabetes, alcohol, hard drugs, unsafe sex, depression, marijuana, poor health-seeking behavior, and of course high-fat diets. We hope that we have shared these facts with you, and they will inform your behavior in the future so that at least you can preserve and promote your health. It has been another good evening for us here on IRFM, and of course this particular program could not have been the quality it has been without the contribution of our special guest tonight, Dr. Keith Wedderburn, consultant urologist from Montego Bay. I'd like to thank my producer, Joy Morgan, production assistants, Kian Cole, technical operator Brian, and of course you, the callers, for participating in this program. And of course you, our loyal listeners in Jamaica and around the world, whose dial is locked onto IRFM. Thank you very much for joining with us on Sex-Wise every Tuesday as we share with you matters having to do with people, relationship, and sex. I'm Dr. Al Bailey saying good night and enjoy the rest of your evening.